Well, I want to thank you all for joining us this morning. We are thrilled at the University of Rochester to help celebrate a very special occasion, the presentation of the Golisano Health Leadership Award to Dr. Steve Sulcus. And that presentation will come in a few minutes, but I wanted to personally congratulate Dr. Sulcus for his extraordinary work and for his commitment to helping those with developmental disabilities, not only at the theoretical level, but hopefully as we advance into the future, increasingly with prowess in delivery systems. We're also joined today by representatives of the Special Olympics, and we're partnering with them and the Golisano Foundation for the ceremony. And I want to recognize three members of the Special Olympics who are with us, or actually two. Mary Davis, the CEO of the Special Olympics International, who is making her first official visit to New York, and we hope there will be many others. And Neil Johnson, President and CEO of Special Olympics New York, with a team that includes several Special Olympic athletes, including Mike Warboys, who we'll hear from in just a few minutes. And I wonder if the Special Olympics representatives could stand and be recognized by the audience. We're also joined by the leadership of the Golisano Foundation. Sitting anonymously and inconspicuously in the last row is Tom Golisano, who's been such a great friend, not only to the University of Rochester and its Golisano Children's Hospital, but to so many institutions in upstate New York, indeed around the country. And I'm thrilled that Ann Costello, who's a great leader of the foundation, has joined us as well. Let me just set the stage a little bit. The Golisano Foundation has provided more than 30 years of advocacy, education, and financial support to programs that enhance the lives of people with developmental disabilities. It's awarded more than $21 million in grants, or about $2 million annually recently, to nonprofit organizations in the Rochester region that serve people with developmental disabilities. This is a program that Tom Golisano began in 1985, and it's grown to be an extraordinary organization. Its partnership with the Special Olympics on the Healthy Commission initiative is just one example of foundation initiatives that empower the health of people around the world. Here at home, Special Olympics New York shares the Golisano Foundation's mission to serve those with developmental disabilities, to help them lead engaged and rewarding lives. It provides wonderful sports training and competition programs to nearly 4,000 athletes in the greater Rochester area alone. These programs allow people with developmental disabilities to develop physical fitness and athletic skills, build confidence, and experience the joy of sports and competition. The University of Rochester is proud to partner with the Golisano Foundation and the Special Olympics on our shared passion for improving the health and quality of life for people with developmental disabilities. And it's now my great pleasure to welcome to the podium Ann Costello.
Thank you, President Taubman, for your kind remarks and for the university's commitment to people with intellectual disabilities. And thank you everyone who is here today. All of you have a part to play in improving lives for people with developmental disabilities, and especially Dr. Steve Sulcus, who we will honor and recognize later in the program. A special thanks to Tom Golisano for his personal commitment and financial contributions as we strive to make the world a more accepting, inclusive place for those of us who live with intellectual disabilities. Tom, thank you for always imagining the possibilities and for challenging us to make inclusive health a reality, not only here in Rochester, but around the world. This quest for us, inclusive health, began in 2010 when we first met Tim Schreiber, who was then CEO of Special Olympics International. From Tim, we learned about the enormous health disparities that exist for Special Olympic athletes and others with IDD. This education led to Tom's first ever international gift to an organization to launch what we call the Healthy Communities Initiative. 4 years later, with a larger, renewed financial commitment, we are on our way to creating 100 healthy communities over the next 5 years. We are today recognizing one of those reasons that we have been so successful with this endeavor, to recognize clinicians who are helping us achieve inclusive health for those with intellectual disabilities. But here to tell us more about the Healthy Communities program, its progress, and the vision for the future is CEO Mary Davis from Special Olympics International.
Thank you very much, Anne, and thank you all for the very warm welcome that all of us in Special Olympics have received as we came here this morning. It's just wonderful to be here in this setting, and the meeting that we just had prior to this event was just outstanding. You know, to have the opportunity to hear and to talk with and to discuss with the experts in the field of neuroscience and the work that's been done in this campus. And as I said, how we can marry that with the work that's been done in Special Olympics right around the world in the 169 countries where we operate, and the tremendous support of Tom Golisano. And Tom, it's a real pleasure for me to meet you today. As I said, I've been hearing your name for so many years now in Special Olympics. Back in Ireland, your name is famous. All over the world, I go to Romania, I go to Slovenia, you know, I go wherever, India, wherever you go, Peru recently, everybody talks about Tom Golisano. I thought, my goodness, I cannot wait. I cannot wait for the day to meet you. So it's a real, real thrill to be here in New York and in Rochester and to have the chance to meet with you and to personally thank you and to say how much, from the bottom of my heart, how much we appreciate the funding that you give us. Of course, it's hugely, hugely important, but more than that, the partnership that we have developed and that you give us Anne Costello as well, because she is, every time I turn, every time we talk about health in the organisation, Anne is there. She's square behind us in what we do. She's encouraging us, she's nudging us on, she's challenging us to do more, to be more, and to me, that's the great strength of a leader. So thank you also, Tom, for lending us Anne on so many occasions. Thank you, Anne, for everything you do. You know, we started out way back in the early 90s, I think, in relation to the whole idea of health screening and the importance of health. Because we really did feel at that time that if our athletes were more healthy, had more healthy lifestyles, were more fit, that their participation on the field of play in the activities that they participated in would be much greater and better, and they could then be the best that they can be. And that's all we want. When all our children are born, and I have 4 children, what do you want for them? You just want them to be the best that they can be. That's what we aspire to for in everything in our lives, for ourselves. We don't want to be the best necessarily, but the best that we can be. And that's what Special Olympics promotes day in, day out. And part of that being the best that you can be is living a healthy lifestyle, being healthy, being fit, being active, being able to participate, and learning the skills so that you can become productive and respected members in the communities in which we live and in society in general. And that's really what this program is about. It's preparing our athletes and all of the people that we can reach with developmental disabilities to be the very best that they can be. And when you look at some of the statistics, and I was looking at them actually on the flight, on the short journey that we had from DC, and you looked at, you know, back then when the research was done in 1997, that there was 60% of adult Special Olympics athletes had weight issues. And 22% never had an eye exam. And 14% had mouth pain that was diagnosed, and 26% failed hearing screenings. When you hear those statistics, you think, my goodness, there is so much work that we need to be doing. And at that time, we were, as I said, doing all of the health screenings, and at our large events, we held all of the clinics, all done on a voluntary basis, absolutely phenomenal what was happening. But how could we scale it? How could we do what we were trying to do, bigger, faster, greater, with more energy? And of course, that's where the Golisano Foundation comes in. And with the generosity that we received, again, from Tom and the team, we were able to start down the road of really scaling and looking at the healthy communities and how we could develop that. And as Anne said, we have ambitions. We want to have 100 healthy communities by the end of our strategic plan. And that is ambitious when you think of all that is involved. And we know that's a challenge, but we know that that's what Tom Golisano wants to do with us. He wants to challenge us every day we get out of our beds. But that's a good thing. And we like challenge, and we are ambitious. And I just want to guarantee you, Tom and Anne and everybody in the foundation, that we will reach our goal. Isn't that right, Drew? We will. Indeed, we will reach our goal. We are committed to it, and we're continually looking at better ways to change the individual health, the healthcare system, the delivery messages, the policies and the attitudes. And if I learned one thing today, I learned at this meeting we had prior to this, that we had the expertise in the room right here in Rochester in New York. We have the trio combination of the university here, the great expertise that exists there. We have Special Olympics, and we have Tom Golisano and the Golisano Foundation and Anne. And with that powerful combination, we can overcome any challenges that are put before us, and we can be where we want to be at the end of the next strategic plan. So thank you very much for the support. We have a very short video now that we'd like to show that will tell you more about, better than I can ever tell you, about the whole healthy communities and what we're trying to achieve through that program. So thanks again.
Organisation for people with intellectual disabilities is actually Special Olympics. Today we're fighting to bring access to quality health services for a population that can face severe health issues, yet frequently receives inadequate care or no care at all.
But Special Olympics has also saved my life through the Healthy Athletes. In 2004, I went through the Healthy Athletes screening at my local summer games in California, and he says, "Dustin, brace yourself, I have some bad news for you, but don't worry about it, I know how to fix it." And he goes on to tell me that I have gum cancer forming in the upper left side of my mouth.
With more year-round healthy athletes clinics and follow-up care in sight, hearing, dental and general health, we can save the lives of more people like Dustin.
The health revolution in our movement is continuing, and the doors of opportunity are swinging open for programs, states, countries around the world to join the healthy community's ideals and embrace the promise that Special Olympics has made to ensure that we do everything within our power so that every athlete who comes to compete is as healthy an athlete as he or she can possibly be.
We've completed more than 1 million health examinations, but this represents less than 4% of our athletes. We need to reach more. For many of them, an examination at a competition is their first chance to even see a doctor. We want more clinics in more places, more focus on diseases that affect our athletes in the poorest communities, more athletes, families and coaches spreading the word, more doctors trained in treating people with intellectual disabilities. Only then can we properly engage with health professionals, governments, policymakers, media and others to bring the core issues which are invisible into the light. Special Olympics has the power to bring the most marginalised and underserviced population in the world out of the shadows. We have the power to save more lives.
Because if it wasn't for that one volunteer in Special Olympics, I would not be standing here today in front of all you showing my $1 million smile.
We also want to challenge all the healthcare systems, from training to clinical care to hospitals and emergency places. We want to challenge them all. Be a healthy community for people with intellectual and developmental differences. Make it your work to ensure that when a person with an intellectual disability knocks on the door, asking for help, asking for care, asking to be healthy, the answer they get is yes. We are a healthy community. Come right in. We'll do our best for you. That's a promise worthy of the history of the Special Olympics movement. But it's also a promise we should commit to for the future. Thanks for being part of the health revolution, all of you. And thanks to those of you who will embrace the ideals of a healthy community.
Thank you, Mary, for sharing that video and for your remarks. I read a quote recently by Henry Ford that sums up how I feel about this journey for healthy communities. He said, "Coming together is a beginning, staying together is progress, and working together is success." We are way past the coming together stage for healthy communities. We've been at this for a number of years. We've moved into making tremendous progress, and we heard about that this morning in our meeting. And we know that we must work together if we are ultimately going to achieve the success that Mary outlined for us today. When it comes to delivering quality health care, it's really an understatement to say that we're fortunate to have a preeminent institution right here in our own town. Not only are there so many different areas of expertise at the University of Rochester and of course Golisano Children's Hospital, there's also extensive research and training capabilities that are second to none. It is my pleasure to introduce Dr. Mark Taubman, the CEO of the University of Rochester Medical Center and the Dean of the School of Medicine and Dentistry. Dr. Taubman's going to share with you some exciting new endeavors regarding healthcare to individuals with intellectual disabilities and the university's commitment to helping us achieve our goals in healthy communities. Thank you, Dr.
Thank you, Anne. I want to extend my thanks also to Tom, to Mary Davis, and to Neil Johnson, the head of Special Olympics New York, and to our Special Olympians. But in particular, today we are honoring Dr. Steve Sulcus, who's a professor of pediatrics and has served as the Special Olympics athletic director for the past 6 years. But Steve has really devoted his entire professional life to people with IDD. As a provider, he is a pediatrician who delivers extraordinary health care. As an educator, he is really focused on sharing his expertise with future generations of physicians and other healthcare providers. And he's an outstanding example of how our faculty extend themselves beyond the walls of the medical center and into the community. As an educational institution, we know that one has to be a student before one really can be a teacher. And we have learned a lot from observing the Special Olympics program, the Special Olympians, and the work that Steve has done in behalf of intellectual developmental disabilities. This will enable us to create a new, comprehensive, broad-based model of IDD care that will not only establish the university as a national leader in the area, but Rochester as the preeminent community working on intellectual and developmental disabilities. One of the things we've already learned is the need to provide the most comprehensive environment to take care of patients with complex issues. This spring, we opened the Complex Care Center, which is designed exactly to do that, allowing patients with a variety of disabilities to get dental care, to get medical care, to get all of their health care in one location. It's also very much the driving force behind our new autism clinic, which will be opening next year, also on campus. And again, the design there is to provide children with autism this same kind of comprehensive care in one location. But it's not just to provide an environment that best cares for patients. Our mission is a little bit loftier than that. It is really to develop new approaches that can better treat patients with IDD, and in some cases, even cure them. And that's really where the research and the clinical meld, and why we are so excited that last year we were able to recruit to Rochester John Fox. John, who has been an internationally renowned investigator in IDD, has really done in New York exactly what we are hoping to do in Rochester, but at the next level, which is to merge clinical care and research to really take it to the next step, to align these two in a way that will allow us to move forward, to allow us to do things that we could never have imagined, not just to provide patients with IDD the best care now, but to create the care for the future. And so with that, I would like to introduce John.
Well, it's a fantastic honor for me actually to be here to celebrate, well, just to add to the Irish quotient first of all, but to celebrate Steve, who I've been working very closely with over the last year. I mean, Steve's the real deal. He's at the coalface. He's beloved in this community. Where we come from, Mary, we call him a gentleman and a scholar, and that's exactly what he is. And I'm very proud to be part of the effort with you, Steve. It's like I say, a great honor. We came from a fantastic meeting with the folks from the Golisano Foundation with Special Olympics and our IDD Leadership Council to talk about ways forward and ways to learn from each other and to develop new approaches here. I'm very grateful to Joel and to Mark for bringing me on board, and as I say, I don't think it's an accident that they chose an expert in IDD to come and lead the Neuroscience Institute, because they wanted very much. I remember our first meetings before I signed on the dotted line, if you like. They wanted very much to have IDD as the central piece of our neuroscience program. And in the end of the day, IDD is neuroscience because it's about intellectual, neurodevelopmental disabilities, neuropsychiatric disabilities. We do the work that we do in the labs. We work with our clinical partners. We work with Steve to make sure that our physicians, our caregivers are trained to the highest standards to recognize these individuals, and we do it because fundamentally these folks have issues with brain physiology and so on. So we're trying to deliver new ways to treat them. Mark mentioned the Complex Care Center. Tiffany is here someplace, I hope. There you are. I wanted to just say a quick word about Tiffany, who is one of the most deeply passionate clinicians I have ever met in my life. It's absolutely extraordinary, the commitment she's brought to the Complex Care Center. I mentioned to Mary before that it opened on St. Patrick's Day. Coincidence? I'm not so sure this year. But it opened on March 17th, and here we are in October, and it's at full capacity. The Complex Care Center, everybody knows that we do a pretty good job, we can always do better, of dealing with children with intellectual and developmental disabilities. But the moment those folks age out of our pediatric clinics, that's when things can get very, very difficult. The Complex Care Center was designed to fill that gap. And the fact that we're 6 months down the road and it's operating at full capacity tells you what the demand for it was. It's just one of the efforts that we have underway. Mark mentioned the Levine Center for Autism Spectrum Disorders. That's a really great model in the sense that we have psychiatry, neurology, into IDD folks. We have all the various aspects of medicine in one space so that when those children come, and adults come to receive care. They don't have to go here, there and everywhere. It's a one-stop shop for them. That's very, very key when you're talking about vulnerable populations, as you know. We've made a great amount of progress here over the last year as a leadership council in pulling together our portfolio, if we will, and trying to devise ways in which we can be better and reach out to our community in better ways. We have a vision. We intend to deliver it. We have a strategic plan around the IDD. Again, we are delighted to be involved with the Golisano folks. Anne is a member, ex officio, of our leadership council and has been a tremendous help to help us understand the messages that are coming back to us from the community. And we're really looking forward to an ongoing developing partnership with Special Olympics. So with that, I'd like to thank you all for being here. I'd like to say again, a great honor to be here to celebrate Steve's efforts and welcome Neil Johnson, President and CEO of the Special Olympics, New York.
Thank you, John. In deference to Mary and to John, I think I'd affect tonight's brogue if you wouldn't mind. Just to make you feel at home. We'll have a pint or two of Guinness a little bit later. We'll keep that under ourselves, okay? Special Olympics New York is delighted to be affiliated, as we've been so many times in the past, with the University of Rochester and with the good people here at the University of Rochester Medical Center and the outstanding, astonishing work that they're doing in the field of intellectual disabilities. And the idea that we have formed this partnership through the generosity of Mr. Golisano and the Golisano Foundation to make this difference local, regional, and global is breathtaking. It's also frightening. But after this much talked about, as you've heard, meeting that has been described, that we've attended previously, it's not that scary anymore. What you folks are doing here at URMC in the field of IDD will crack the world right open. That full-born approach, that whole person, that cradle to grave or cradle to cane, approach that you're taking to effecting change in the wellness and health for people with intellectual and developmental disabilities is breathtaking. I only hope that we can continue to make the strides. It's going to be a long fight, but we can make the strides to make it happen because it is beyond necessary. It's an ethical, moral right and obligation that we have to our friends among us who are differently able. I'm happy to be part of it. A little bit about Special Olympics New York and the Golisano Health Leadership Award. Special Olympics New York, we're proud to say, is the largest Special Olympics program in North America. We serve nearly 68,000 children and adults all year round in 22 sports. We produce almost 5,000 competitive events a year with a network of almost 35,000 volunteers. We're pretty proud of the accomplishments that we've made here for our athletes across the state of New York, but the most astonishing and one that we take the most pride in is that Special Olympics New York provides the most healthy athletes' experiences and exposures in all of the United States, right here in the state of New York. And that happens because of people like Steve Sulcus and the others here at the center that you all created to face the world and make differences in the lives of people with IDD. The Leadership Award that Special Olympics and the Golisano Foundation created is an effort to both recognize those among us who have stepped forward, who have made the strides, who've made the sacrifices, who recognize the challenges, who recognize that the answers have to be found. Then they've gone out and they've said, I'll show you how to do it. The leaders that we recognize with this award will be people who not only walk the walk, but they talk the talk. Steve Sulcus, Dr. Sulcus, has done sports physicals exams for our athletes so they could participate. He's making a difference in the next generation of healthcare professionals by making them more in tune and prepared to better serve the IDD population, something that hasn't happened previously. He's an advocate. He's standing up and saying this has to be done across the country. That's what the Golisano Leadership Award is. It's recognizing those among us who have said enough is enough, time to make a difference, and time to change the world. That's what the Golisano Health Leadership Award is all about. To tell you a little bit more about the value of what it is, I'd like to introduce you to one of our athletes who has benefited directly, personally, from our Healthy Communities programs. But at the risk of, not the risk, but I say as most of our news colleagues say, with full disclosure, there's a little bit of animus between this young man and myself. He continually beats me in bocce. He won't give me a shot to beat him in golf. Anything he challenges me to, I end up on the short end of the stick. But he's an incredible young man, and he's an incredibly inspiring athlete right here in Rochester. Please welcome Michael Warboys. Michael.
Hello, my name is Michael Warboys, and I am a Special Olympics athlete. I also am a member of the Special Olympics New York Congress, and I have been training and competing with Special Olympics for over 20 years with lifetime assistance. Right now I am training for floor hockey. I also compete in basketball, the shot put, in track and field, soccer, softball, golf, bocce, which Neil needs to practice more. And my favorite sport is powerlifting. And I'm sorry about that, Neil. Being an athlete with Special Olympics has given me confidence. It has taught me respect and sportsmanship. I have developed deep friendship with other athletes on my team and with my coach, Peggy. Special Olympics has helped me to become a leader and a mentor towards my peers. Through Healthy Communities, I have learned a lot about taking personal responsibility for my health and staying focused on a goal. Healthy Communities, which was made possibly by the Golisano Foundation, gave me a Fitbit that I wear every day. I always get more steps than anyone else on my team. My secret is that I work at Wegmans and I'm on my feet all day for work. I have become a role model to my teammates, and I encourage them to walk more and eat better each day. I am pretty healthy and active guy, but I still always come over to the Healthy Athletes tent. It is one way I can be a role model to other athletes. And I always learn something. One time I found out that I had a cavity in my tooth, and because a Healthy Athletes volunteer saw it and told me about it, I was able to make an appointment with my dentist to get it fixed. I want to thank Dr. Sulcus for his work with Healthy Athletes program and for encouraging others to get involved as well. We need more students and more healthy professionals who know how to work with athletes like me. And your work, Dr. Sulcus, makes that happen. I also want to share my experience with the team trainer program a program that Dr. Sulcus created with Special Olympics team, trainers, and students. Training to be doctors and dentists who volunteer with Special Olympics sports teams. My trainers, Stephanie, Cynthia, and Prachi, come to my softball practices. They encourage me and my teammates to set healthy goals. They also come with us to healthy athletes. And most important, they got to know me and other athletes. And what could be better than that? I want to say congratulations to Dr. Steve Sulcus and thank you to Tom Golisano. Your investments in the healthy of athletes like me makes a world of difference. Thank you.
There's a saying or a rule in Special Olympics that you never follow an athlete. And now here I am following an athlete. Actually, he talked a lot about Steve, and some of his remarks are similar as mine, but we have a wonderful video that's going to run while I'm speaking about Steve. So I guess we can roll. I've worked with Steve for a number of years on many exciting projects. I'm delighted to be here with the opportunity to talk about Steve Sulcus and why he's been chosen for the SONY Golisano Healthcare Leadership Award. In preparing my remarks, I naturally went to the internet to pull up his official bio to make sure I had all the facts. Here's what I found. Dr. Sulcus is a triple board certified pediatrician in developmental behavioral pediatrics, neurodevelopmental disabilities, and pediatrics. He joined the URMC faculty as a pediatrician in 1984 and has been co-director of Strong Center for Developmental Disabilities since 2008. Among the many credentials on the internet and awards, it also mentions that he was presented with the Golisano Foundation's first ever Health Leadership Award in 2010. But here's what I didn't find on the internet. They didn't tell us that Dr. Sulcus works to give all children and adults with intellectual disabilities the same opportunities for high quality health care in the same settings as you and I. They didn't tell me that through his clinical practice, research, and community outreach, Steve aims to provide equal opportunities for people with IDD to participate in the community. They didn't tell me that he's a champion, a clinician who has demonstrated an extraordinary commitment to expand access and improve health services, to change attitudes, and to raise awareness of the gifts and talents of people with intellectual disabilities. Steve knows that people with ID have the right to acceptance and inclusion, and he promotes this each and every day in his work. He values those with ID as people who can contribute and be active parts of their community. The internet also didn't say that Steve works tirelessly to expand the Special Olympics Healthy Athletes program, as Mike and Neil have mentioned, that he works tirelessly to increase athletes' ability to participate in follow-up care as well as year-round fitness, and that he works to advance the health rights of people with intellectual disabilities. As many have mentioned, Steve was trained as the Special Olympics Clinical Director of MedFest at our first ever regional Train the Trainer event held in Rochester in the fall of 2010. In this capacity, he has led many events since that time, performing sports physicals for athletes who might not otherwise access them. He's also encouraged many other students and colleagues not only to volunteer for healthy athletes, but to become clinical directors themselves. Thanks to Steve's commitment, the Healthy Athletes program has grown significantly in New York as a direct result of his involvement. More recently, Steve has become the lead advisor to Special Olympics New York on the Healthy Communities Project, providing expert guidance on achieving the objectives around follow-up care and wellness programming. More specifically, on the local front, Steve was a key member of the Eastman Oral Health Special Needs Dentistry Task Force in 2011 and 12. One of the contributions he made was to create a list of actionable recommendations based on the work of the group. Out of the recommendations, the Eastman Institute of Oral Health was able to secure funding for the purchase of a Smile-mobile that will provide comprehensive oral health services to people with ID in the places that they live and work. As part of the URMC IDD Leadership Council that Dr. Fox spoke about, Steve works with administrators at the new multidisciplinary clinic for patients with special needs, or the Complex Care Center. A national leader among his LEND peers, Steve serves as the director of Rochester's LEND program. That stands for Leadership Education in Neurodevelopmental and Related Disabilities. He is training the next generation of care providers, ensuring that each trainee is skilled in interdisciplinary teams to become leaders in service to this population. He's also the president-elect of AADMD, the American Academy of Developmental Medicine and Dentistry, and has been one of the lead advocates on the national scene in the effort to have people with IDD recognized as a medically underserved population. Steve, when do you sleep? We're glad you don't. He also started the student chapter of AADMD, a very active group. As Michael mentioned, they formed the Team Trainer Project, which will now be replicated in 15 states around the United States. And they also spearheaded the local End the R Word campaign here in Rochester with Steve's help. As we know, this awareness campaign is a reminder to all of us that words do matter, and that the word retarded does not have any place in our society, as it just perpetuates the negative stereotypes with people with intellectual disabilities. Steve, thank you for your unwavering dedication to enhancing the lives of those with IDD, and for continuously leading the way by your example. We've had a nice decade together, and I look forward to many years of work. Thank you so much. And now Neil Johnson will present the award to Steve.
Mary, would you be kind enough to step up, please? Mr. Golisano, if you would, we'd love to have you up here. Dr. Steve Sulcus, Golisano Health Leadership Award. Prestigious award is presented in recognition of your outstanding leadership in Special Olympics New York health programming and your ongoing commitment to advancing inclusive health for people with intellectual disabilities. On behalf of the entire Special Olympics family, thank you so very much for what you do to help our athletes. Michael, would you do the honors, please? Present that to Dr. Sulcus. Thank you.
Just a few more steps on my Fitbit than Mike has on his so far today. But that was basically preparing for that meeting that we just came from. So thank you. Thank you all. Thank you everyone who spoke and everyone in the room. I'm so honored. This is a recognition that goes not just to me, but to my colleagues at Strong Center for Developmental Disabilities and across the University of Rochester. This is a lovely, lovely honor, and we all appreciate it. Now, what we're about here today is very easy to conceptualize, but it's much harder to bring to reality. The goals that we're talking about are working toward full participation and self-direction in all ways for people with intellectual and developmental disabilities. I'm going to repeat that. Full participation and self-direction. Now, that doesn't sound like health, right? So let's just talk about where health comes in. To do that, people have to be included. They have to be included in all aspects of their communities. But to be really included in every part of your community, you have to be healthy. So there's where the health comes in. But to get help, but people with intellectual and developmental disabilities don't have optimal health. We have lots and lots and lots of data from our community, from the state of New York, from nationally, showing that health disparities exist for this population and we need to work on them. So people with IDD don't have good health yet. We're getting there, but not quite. But why? Well, people don't have access to sensitive and responsive healthcare providers. So what can we do to help with that? Well, we can create specialized services for the most complex, like the complex care center that we heard about. The other thing we can do is have every provider in the community be more knowledgeable. So we have to train people who are in the community, who are working with everyone with developmental disabilities so they can be smarter and have the work that they're doing go more fluidly, so they're more willing to accept people into their practices. Then we have to work on health interventions. We have to figure out what matters in healthcare to help people with IDD be most healthy. And that requires data. Data not just from our community, which we're working on, but data from around the country and through Special Olympics around the world. And finally, that data that we collect has to go through the research process. We have to actually think about it. And we also have to do research, as John said, to help to understand and minimize the impact of developmental disabilities in the first place. So, Special Olympics has done so much to bring this conversation into the mainstream of our society and to show the capabilities and contributions that those with IDD can make to our world. And the Golisano Foundation is making this a worldwide focus. So the Healthy Communities effort just takes it global, makes it a public health effort. It's what has to happen. So, and we're very excited here to participate in that and to be advancing the level of care and the breadth of services to people with IDD. We're working with some other partners too, and you've heard them mentioned here. One is the American Academy of Developmental Medicine and Dentistry. Another is AUCD, which is our network of university centers like our Strong Center for Developmental Disabilities. Both of those organizations are working to accomplish national policy advocacy and training for all the providers in all the disciplines who work with people with IDD. Special Olympics and Healthy Communities are important bridges to the future of what else is possible, and the health data that we collect at athletic screenings locally and nationally and internationally help us as providers and help the athletes as individuals. Taking that a step further and crunching all that information becomes really important in learning where to go next. And that's really wonderful. We did a little exercise at one of our local screenings where we had open the electronic medical records for the individuals when they came to Strong and their records when they were at Rochester General. And there in one Special Olympics health screening, we were able to access medical records for these people and provide information to them that they didn't know, like they didn't know what kind of medications they were taking, and back to their primary providers. We say, we saw your patient and here's some stuff to think about. The Special Olympics was lovely in sharing some of the national data with us so that we could compare our local screening data to a national data set. It was great, and it showed that what's going on in Rochester is in many ways better. Probably we have a somewhat healthier community than the national norm, but we learned a lot from that. And we're using other studies like that to help our dental and medical trainees go the next step, get them involved in both research and service through the Healthy Athletes and team trainer projects that you've heard mentioned. That is really powerful. That gets medical and dental trainees out in the community, so they're getting out of clinical environments and seeing individuals with IDD not as patients, but as people who live in the world, people who have fun, who are participating in athletic events. It's a real perspective changer, and I think I thank Annalise Stephen for creating that project. It was wonderful, and I'm so thrilled it's going big. Our training goes on in medical school, in residency, in fellowship. We're doing all those things. We've been doing those for a long time. The Complex Care Center is adding one very, very useful new venue for training, and that's going to help us with training not just people coming up, but community providers. So it's great. We're very happy about that. And finally, the other thing that we're getting to do is bring together two systems that have been apart from each other. The developmental disability system and the healthcare system have sort of grown apart. They used to be very close. They've grown apart from each other. And some of the work that we're doing is allowing us to get to bring them back together so that we learn from each other, so that we share information, share challenges. So the community agencies that serve people with IDD have now once again become important partners for us. There's a lot to be done still, obviously, and our meeting earlier today was a helpful step in that direction. I think that we have to move beyond our clinical and local focus, and I want to just make another plug for the Medically Underserved Population Initiative. It's my, as I said earlier today, this is my public policy hobby horse, and I'm going to keep pushing it. And so talk to your legislators. We want it to happen. Talk to Governor Cuomo. Okay, anyway, I am very honored to be one of the first recipients of this lovely award. Thank you again. Okay. And I am just very, very touched and honored. And now let's get back to work.
Congratulations again, Dr. Sulcus, and again, thank you for all the things that you do, not just for our athletes here, but for people with IDD around the globe. And thanks to all of your colleagues here who are leading the way for all of us. That concludes our program today, and we want to wish everybody a great rest of the day. We have some cake up above that we'd like to cut and share with you all. I'm first in line, thank you. I need to tell you, Michael used to have a shape that was much closer to mine until he got into the Healthy Athletes program. So I think I better start chasing you around. But thank you for being here. Some of the people will be here if people have questions and want to further understand what's going on. But again, we appreciate all of you being here today. And thank you again. Thank you, Dr. Sullivan.